Methods. All right, for more reaction to the president's plan, I want to invite Republican Congressman from Georgia, Buddy Carter. Representative Carter is a friend of mine. He's a member of the House Energy and Commerce Subcommittee on Health. He is also the only pharmacist in Congress and the co-chair of the House Community Pharmacy Caucus. Representative Carter, good to see you. Thank you for being with me. Talk to me about what I was just talking to Gary about, the idea that it does seem to be that the overprescription of opioid pharmaceuticals is part of the problem here.
Well, it's a big part of the problem, and I think he's spot on. It's something that we've got to get under control, and that's part of what the president has been proposing is more professional education for healthcare providers, doctors, and pharmacists. You know, how to properly use these medications. I thought his point was an excellent one. I've seen it when I was still practicing pharmacy, doctors with all the best of intentions who overprescribed these medications just simply because they were not as up to date with the impact that these drugs can have. So I think he's spot on in what he's saying.
This is an interesting point, Congressman, because we had these arrests earlier last week, and we see these from time to time, and we've got investigations into some of the drug companies. But ultimately, there are a lot of good doctors who think it's the right thing to do. That, you know, we have sort of sold doctors on the idea over the years that pain must be eliminated at all costs, and they are trying to alleviate their patients' pain and creating addicts in the process.
Well, they are, and as I said, with the best of intentions, and you're absolutely right, Ali. This is something that we in the federal government were actually encouraging by reimbursing more as a result of the reviews that patients gave their doctors of their pain levels. I mean, to a certain extent, we're responsible for this as well. But what we've got to do is to re-educate these physicians and these healthcare practitioners about these medications, because they're great medications if used properly, but when they're not used properly, obviously we see what we're suffering with now.
And this is an important point you make, because I always get social media messages from people after we do these segments to say, I'm in real pain, I suffer. As Jacob Soboroff was saying, cancer is one of those things for which, fentanyl is one of the only effective painkillers. For those people who are getting it prescribed properly and who are suffering from certain types of pain, they shouldn't be worried that fentanyl is going to be a problem. It's a different issue.
Absolutely, and that's one thing I continue to remind my colleagues in the committee on, is that we've got to be very careful that those people who truly need these medications still have access to those medications. I was a consultant pharmacist for hospices for many years, and I can tell you they're in need of these medications, and there were actually times when we were running out of the medications because we had those who were abusing it and addicted to it, who were using so much of it, we didn't have any left for those who truly needed it. So we have to be very careful in balancing the access to people who truly need it here.
What do you tell people who are out there today, because there are many Americans with legitimate prescriptions for opioid painkillers, and they've got them and they're saying, am I going to become a drug addict as a result of this?
Well, I would tell them to be very careful, to work with their to work with their physicians, to make sure that if they feel like they're in danger of that they talk to their physician and talk to their pharmacist so that this doesn't happen. One of my children had some surgery recently. My reaction was, whatever you do, don't take any opioids. I don't want them to be in pain, and people need these medications, but at the same time, when you go to have a dental procedure and you get 30 OxyContin, that's not necessary. That's why we're right now in the Energy and Commerce Committee, we're looking at ways that we can revamp the system. And we've got 25 bills that we're considering right now. Some of them address just this type of situation.
Congressman, we're looking at 2015, 2016 numbers. Georgia's not even on the list of the worst states for overdose deaths, but they were in 2015, there were 1,307 overdose deaths, drug overdose deaths in Georgia, 68% of which were from opioids and heroin. And obviously, some of those are street drugs, and some of those are people who turn to those drugs after having, as Gary Mandel said, been introduced to them by prescription drugs. I wonder about the president's focus on drug dealers and executions and things like this, when this seems to be a slightly different problem than the crack epidemic.
Well, the president is right. We've got to be tough. And I suspect suggesting the death penalty will get some people's attention. It should. We do have to be tough. But that's obviously something that's got to be based on a case-by-case basis. And but when you look at fentanyl and the problem that fentanyl is now, we've seen cases where it is so potent that it is killing people just with one dose. In those situations, you can make the argument that that's murder on the part of those drug dealers there. And yeah, that's where we need to have the death penalty. If they commit murder, then that's
is there a danger that we lose focus on the drug companies that decided that this is going to be the solution? I don't think they intended death when they did it, but that push opioid painkillers on people?
Well, what I'm talking about is the illicit fentanyl that's out there that has been increased in its strength and its dosage. But you know, the pharmaceutical manufacturers have to be held accountable as well. Let's face it. And I always say that I've seen miracles in the way of research and development over my years of practice in pharmacy. However, I do think the pharmaceutical manufacturers are really doing us a disservice, because right now, once you go away from tramadol and ibuprofen, you go to the opioids, and there's a big gap there, and I've called on the pharmaceutical manufacturers to fill in that gap. We need their help here.
Congressman, always good to talk to you. It's even fun when we're not fighting.
Yes, it is. Thank you.
Good to see you, sir.